Why are so many doctors leaving medicine? In this video, we're going to talk about that. What's up, guys? My name is Dr. Antonio Webb, and I'm an orthopedic spine surgeon here in San Antonio, Texas. So every time that you turn on social media, YouTube, Facebook, Twitter, Instagram, there is someone that is talking about leaving medicine. Well, why is that? There are a number of different reasons why that I've come up with that people are leaving medicine. I put out another video several months ago, and I'll put that right up here, about my kind of conundrum that I faced of whether to leave medicine. And there are a lot of other physicians that feel the same. There are a number of different reasons why. One of the big reasons is actually burnout. COVID has really put a damper on the healthcare system. It's really weakened the healthcare system. A lot of physicians got burnt out during COVID, and even before COVID, there are a lot of physicians who express burnout and also depression. Suicide numbers are actually going up. A lot of practices went bankrupt, and they had to close their doors during the COVID pandemic. It was a quote number that I saw, about 8% of doctors representing over 16,000 practices shut down in 2020 due to COVID's impact on business. So a lot of people are just tired. They're tired of working. It's a lot of stress and responsibility, the litigation concerns that a lot of physicians and practices have. People are just tired. And that's one of the big reasons why I think that doctors are leaving medicine. They're being burnt out. And Medscape always puts out these surveys where they interview thousands of physicians, and those physicians kind of quoted a number of different things: the work hours, the bureaucracy, the politics, the paperwork, and it was quoted that up to 25% of some people's days they spend doing paperwork and getting on the computer and doing all these daunting tasks that are required to get paid. So burnout is a huge issue, and a lot of physicians are really being impacted by everything that has went on during the pandemic and that is currently kind of going on. The second reason why a lot of physicians are quitting medicine is the loss of independence. Since the COVID pandemic, the number of physicians in private practice has decreased. A lot of physicians in these private practices, they're being acquired by big corporations and private equities and by hospital systems. They're buying up practices left and right. There was some quotes, some numbers, that 74% of physicians were employed by hospital or corporate entity in January of 2022. 74%, that's crazy. I certainly believe that, the next 5 to 10 years, that most physicians, even higher than this number here, will be employed. And that's a concern because some physicians don't want to be employed. And there's a lot of physicians that will leave medicine if they have to work for a big hospital or a corporation. People just don't want to do it. There are a lot of downsides to doing that. You lose a lot of independence. You don't have that autonomy to just do and practice medicine the way you want to practice. You have your employer or the hospital, this corporation, telling you how to practice medicine. And imagine going 14, 15 years of school and training to have someone that has never stepped foot in the operating room to tell you how to perform or what to use in a particular surgery. It's mind-blowing. But that's kind of what's going on. Insurance companies, we're losing control. They're mandating that we practice medicine the way that they want us to practice medicine, use what medications they want us to use, do what particular surgeries they want us to do. There are certain insurance companies I have to use a certain implant in surgery because that's what the insurance tells me. Otherwise, they won't pay me. So, it's one of those things that, this whole healthcare system, the amount that we spend on, our GDP for healthcare in the US, it's one of the highest out of any countries that are out there, but we have some of the worst healthcare. And out of any other country, which doesn't make any sense to me. So a lot of physicians are going employed, especially a lot more after COVID pandemic. You can see the numbers of employed or corporate entity physicians is skyrocketing, 74%. That is crazy. And I personally know people that said, hey, I'm not going employed, I'm not doing that, I will leave medicine. And I hear that all the time from physicians that are, these corporate entities are calling, private equities are trying to buy their practice. There are a lot of pros and cons to both. Certainly, don't get me wrong, there's pros to being an employed physician, but there are a lot more cons also And some people are just not going to deal with that. Another reason why physicians are quitting medicine. The reimbursements are going down, the expenses are going up. There's, some studies and some literature out there that is looking at the inflation rate and also looking at Medicare's reimbursements. In January of 2023, Medicare plans to further cut our pay by 8.5%, which is crazy that they're planning to do that. But this is what I encourage those of you out there that are physicians, providers, healthcare practitioners, to contact your representatives in Congress to let them know about the H.R. 8800 bill. This was a bill that was designed and written up by Dr. Barra and Dr. Bouchon. They're both physicians, to protect patients and also address the systemic issues with the Medicare physician payment system. So the Surgical Care Coalition, this is an organization. They advocate for access to quality surgical care for Americans. They're comprised of 14 professional associations that represent more than 150,000 surgeons and anesthesiologists. Well, they reached out to me to just speak about this topic, and I think it's a very important topic to speak about, and I also wanted to use my platform to get the information out there. So what they do is they work with surgeons and anesthesiologists and other physicians across the country with a common goal of improving the quality of care, the quality of life for essentially all patients. That we need to contact our local representatives, contact the people that work for us in Congress. It's a bipartisan agreement, and it's a joint kind of venture to minimize or decrease these Medicare reimbursements. Because I truly believe that if these Medicare reimbursements actually go into fruition, if they pass this law that says we get paid less, it's going to really impact patient care and the access to care. There are a lot of physicians that are not seeing Medicaid patients, and that's only going to hurt and worsen the already tumultuous healthcare system that we have here in the US. So I'll put a link in the description with some more information to contact your local representatives in Congress and let them know to look into this bill so we can get this bill passed. It's the H.R. 8800 bill. That's Supporting Medicare Providers Act of 2022. So that's one of the reasons why physicians are leaving medicine also, is that the reimbursements are going down, especially in spine surgery and neurosurgery, where we're doing really complex surgeries. We got paid a certain amount for that particular surgery 5 years ago. We're doing the same surgery now, but we're getting paid less, but expenses are way up here. So how do we meet in the middle and make things work? And that's why a lot of physicians are leaving medicine. That's why a lot of physicians are leaving private practice, because the expenses are going up. And I have other videos about overhead and how much we have to pay to just make ends meet each month. And sometimes it's a real struggle. So there are a lot of different reasons why physicians are leaving medicine: loss of independence, declining reimbursements, increase in expenses. People are being burnt out, less autonomy, more control by insurance companies, private equity firms, corporate organizations. People are just tired. And I don't want to make this video to discourage you from going into the field of medicine. Don't get me wrong, it's one of the best fields out there. I love what I do. The ability to just help patients when they're at some of their lowest points of their lives, and just use my hands to help patients from a surgical standpoint or medical standpoints, and help them kind of get back to life. So there's no other field out there that's like it. And even if you go into engineering or to tech field, consulting, business, law, I mean, there's pros and cons to any field that you go into. But these are some of the reasons why physicians are quitting medicine. What are your thoughts? Why are physicians quitting medicine? Every time I go online, there's someone else that's, hey, I'm quitting. I'm not doing this anymore. It's sometimes overwhelming just seeing that, and people are just exiting left and right. There are studies out there that I saw that 1 in 5 physicians are leaving or have left medicine, and this is a huge problem. We already have a lack of physicians, a shortage of physicians, especially primary care physicians. This will significantly impact our healthcare system. Contact your representatives in Congress. Let them know about that bill that we need to pass. This is not just for physicians or myself as a doctor. This is for patients. Their access to care will be significantly impacted if the decline in reimbursements actually kind of goes through. So Thank you to the Surgical Care Coalition. They have worked in 2019 when the Centers of Medicare and Medicaid Services first introduced these reimbursement reductions in 2019, also in 2020, and in 2021. They helped delay the cuts in 2020 and 2021, and hopefully, we can delay these proposed Medicare reimbursement cuts, which is crazy. Thank you guys for watching. This is Dr. Webb, and we'll see you next time.